Good afternoon, ladies and gentlemen. We're delighted to have you here for this session of the World Health Summit that will also then lead us into the very special session we will have together with the global challenges at 6 p.m. We are going to focus in this session on what is now being called the Global SDG Action Plan. And this is an extraordinary document. It says, for those of you who have been able to already glance at it, that this is a historic commitment to unite for health. And this uniting for health is, I think, the theme that runs through the Sustainable Development Goals. It's the theme that is particularly present in the SDG 17. It's a theme that means global organizations need to work together. At country level, all sectors need to work together. All ministries need to work together. And this theme is one that is driving us forward. We will discuss here at this panel, first of all, how this action plan came about. There's a famous letter that went out, and two countries that are signatory to this letter are here with us today, Germany and Ghana, and they will tell a little bit of the why, so I'm not going to take that away from them. The Director General of the WHO, Dr. Tedros, will then address us and tell us what he did when the letter reached his desk, and then how the many organizations that were involved worked together. Again, those of you that might have seen it will remember there is one page right at the beginning with the signatories of 11 organizations saying we historically commit to accelerate together, accelerate the implementation of the SDGs. After Dr. Tedros has spoken, we will hear from a group of ministers, and this is very important because it also reflects, what is happening at country level, how do countries respond to this energy that has developed at the global level. And we will first hear from one of the countries that is also taking on global health leadership. We have with us Minister Vidal from France. She's the Minister of Research in the French government, and she will underline a number of the new initiatives that are also coming out of France. You will have heard that the Global Fund replenishment is going to be hosted. France is hosting the G7 next year. So this underlying theme of the political dimension and the political commitment that is needed to move forward will be highlighted. We then have to reflect also the multi-sectorality. We have with us Secretary of State Barthle, also from Germany, but from the Ministry of Economic Cooperation and Development, the ministry that funds the German support to countries, both bilaterally and multilaterally, so that voice is absolutely crucial. And then we have two more ministers of health from Ecuador and from Uganda, who will give us a perspective from their part of the world and from their country, what cooperation can mean and how we will move forward. We'll be very tight for time because we will have to move to the other venue, so we hope we'll balance our way through. It's very important, though, as I've discussed with Dr. Tedros, that once he has heard from the others, that he has, an opportunity to respond once more and give us that feeling for how we move forward. The theme with which the previous panel ended was global solidarity, and that we need to create this new movement of global solidarity. We're really at a time when sometimes we feel the world is fragmenting away. We need to come together And with what other issue or subject could we come together than health? Health is pivotal, health is at the center of the SDGs, and health makes a difference for so many other SDGs that we'll want to be reached. So it's my pleasure to first ask Dr. Babette Stier from the Ministry of Health here in Germany. She is the Deputy Director General for European and International Health Policy. Please, Dr. Stier.
Director General Tedros, Excellencies, ladies and gentlemen, we all know the Agenda 2030 is visionary and ambitious. However, it is also realistic. We are convinced that we can achieve it. But we need to have a clear plan for its implementation. All of us need to contribute, and coordinated action is necessary and of key importance. 3 years already have passed since the adoption of the 2030 Agenda, and it is clear, if we really want to achieve the ambitious health-related goals, we must significantly step up our joint efforts. We have to unite to accelerate progress towards the health-related SDGs. And one key challenge in the implementation of the health-related goals is the fragmentation of global health. Unlike 70 years ago, today the global landscape is full of diverse actors and various initiatives. So there are a lot of hands and brains, and there's a lot of expertise and power out there. But in view of the large number of actors in the health sector, we need international coordination. We need a clear understanding who is in the lead for the joint efforts and where we stand. Otherwise, duplication, efficiency losses, or gaps will occur. What we need is cooperation, alignment of strategies, and the joint commitment for success, or, as you just said, global solidarity. The World Health Organization is a crucial actor in achieving the Sustainable Development Goal 3 because it is the only international organization with universal political legitimacy in global health. WHO's 70-year-old constitution clarifies our joint expectation. WHO is the directing and coordinating authority in global health. And that is the reason why Germany, together with Ghana and Norway, took the initiative to ask Director General Dr. Tedros to draw up a global action plan for healthy lives and well-being for all. And this is very important, in partnership with other relevant stakeholders to help accelerate the implementation of SDG3. And by now, we can see that the joint development of the action plan itself has strengthened and will further foster cooperation and coordination among international health organizations. This already is a great achievement. In German we say, don't praise the day before the evening, meaning before knowing the outcome, don't speak too positive about the subject. But I think it's more than appropriate to take the opportunity to thank Dr. Tedros and its team for having taken up this challenge and having started an extensive consultation process. That has been done with an approach and an attitude as a primus inter pares, a process between equal partners. And therefore, at the same time, I want to thank all organizations for their willingness to get involved and to engage in the action plan process as they did. Through coordinated action, existing resources and the international level will be used more efficiently in order to achieve the best possible results and effects. We are confident that the SDG Action Plan is a decisive step for the timely implementation of the health goals of the Agenda 2030. And now, as well as you all, I'm very keen to hear from Director General Tedros about the substance of the action plan. So, thank you very much.
Thank you very much. And Dr. Stier already alluded to the process, and often the process is as important as the outcome. And again, those of you, and I see a number of you have the action plan in front of you, I think it is worthwhile to see what group of very strong organizations has come together next to the WHO. There is UNITAID, UNDP, the Global Finance Facility, the World Bank Group, UNICEF, UNAIDS, Gavi, the Vaccine Alliance, the Global Fund to Fight AIDS, Tuberculosis and Malaria, UNFPA, and a thing that particularly pleased me, UN Women has also joined this initial step of the move forward, and we'll hear more about how the plans will proceed. But first, it's my great pleasure to give the word to the Minister of Health of Ghana, the Honorary Kwaku Agyeman-Manu. Please, Minister, Your Excellency, take the floor.
Thank you very much, and good afternoon. Director General Tedros, Excellencies, distinguished ladies and gentlemen, we meet in the city known for its natural beauty and cultural history. I'm in Berlin. Governments all over the world have major parts to play in tackling the growing health threats and also priority setting for action. Critically, governments have to enter into partnerships, both public and private, to ensure everyone has access to critical health services and to ensure we leave no one behind. In the new SDG agenda, health is only one of the 17 goals, and only 13 out of the 169 targets focus on health. NCDs, road safety, chemicals, nutrition, and mental health. Outside the health goals and targets, other goals and targets, for example, on education, gender equality, agriculture, human rights, and energy, will influence the attainment of the health goal. Thus, multi-sectoral cooperation and multi-stakeholder partnerships will be needed. This clearly is a major policy shift from verticalization to integration. Ghana remains committed to the Global Sustainable Development Agenda. The principles of sustainable development have always been embedded into Ghana's development planning and is further emphasized in the current Health Sector Medium-Term Development Plan 2018-2022 for Ghana. Achieving universal health coverage requires national leadership, and the President of the Republic of Ghana, who happens to also be the co-chair of the SDGs, is committed to this. The Ghanaian experience looks at achieving UHC from a three-pronged approach. These are access, quality of health care, and financial risk protection. We are using the following mechanisms. In terms of physical access, we strengthen our primary healthcare system with our community-based health planning system policy, which will ensure universal access to health care at the basic level. We're also embarking on major infrastructure developments at the secondary and tertiary level. Financial risk protection is being achieved through our National Health Insurance Scheme, which is currently undergoing reviews to make it fit for purpose. And to ensure quality standards are maintained, we have developed a national quality strategy which will ensure that quality standards are achieved in all our health agencies. In addition, we'll also have a national quality manager to ensure the strategy is implemented as planned. Our policy focus as a country is on health and education to ensure we are able to harness the demographic dividend. It is for this reason, and in the spirit of partnerships, that our President, His Excellency Nana Addo Akufo-Addo, and the leadership of Germany and Norway requested WHO to develop an action plan to rapidly propel progress. This is what we are launching here today, and we are grateful for their leadership. We want a plan that will mobilize action across the global health community to produce measurable results and working in partnership with other countries. Beyond this plan, we critically need to examine our delivery chains in our individual countries and map them out so as to identify the weak links and rectify them. But achieving SDG3 is not only a matter of research or partnerships or visibility. We need agency. We need purpose. Above all, we need leadership. Time and time again, the leadership of the global health community, researchers, practitioners, and donors alike, has been pivotal in catalyzing change across nations and across the globe. This time is no different. If achieving SDG3 is to be a reality, it can't only be a catchword. It has to be a movement, a community acting with purpose, reaching out to actors beyond the field of health research to build a truly global coalition, mounting a worldwide effort to bring health coverage to every individual in need. We charge everyone here to be part of this unstoppable movement. This meeting is an example of the energy and momentum we need to build such a movement. In conclusion, and as I stated in the beginning of this speech, to leave no one behind, the SDG3 development agenda needs to be able to be implemented, measured, and reported on by all member states, particularly those in special circumstances. Ghana believes that a practical and common sense approach is needed as we continue to strengthen the targets and determine effective indicators. I thank you very much for your attention.
Thank you very much, Your Excellency, and please convey our good wishes to the President and thank him for his commitment. Some of us who are moving on will then be able to hear from the third signatory of the letter, Prime Minister Solberg, at the next event, and that will complete the trio of countries. You mentioned leadership, you mentioned cooperation, and it is now my great pleasure to ask Dr. Tedros, the Director General of the WHO, to give us a glimpse of what happened, as I said, when this hit his desk, how the process was in working together with the other organizations, and what the outcome was, and how we will move forward together. An action plan, of course, means that you map out the actions, that you map out the phases of your actions, and that you indicate the accountability. We are really thrilled to have you here with us, Dr. Tedros. We know you've just come from Sudan. Anybody following Dr. Tedros on Twitter will think there's at least 5 of him. What he manages to pack into one day. He is also dealing, as you know, with the situation around Ebola and the emergency committee that is meeting tomorrow. So while we talk about plans, the world goes on, the emergencies are there, and we will tend to deal with all of it at the same time. Please, Dr. Tedros.
Thank you, Ilona, for that kind introduction. I'm actually 10, not 5. Because of you, meaning together. Through you, through me, through all of us. So, not 10, even more. So thank you so much. I'm glad you raised Sudan. Maybe, if you allow me, I will start from there. I met a young boy. His name is Hasab Al-Karim, and he was hospitalized in a cardiac center in Khartoum. The hospital where he was hospitalized actually is a good model of private-public partnership. The government covers 50%, and the NGO, called Emergency, raises the 50%. And those who are benefiting from the cardiac center not only are Sudanese, but from many countries, from the neighborhood and even beyond. And everything is free, no pay. And this young boy, Hasab Al-Karim, he had malaria infection initially, and they detected sickle cell disease, and then rheumatoid heart disease. And he was operated, and the operation was successful. This 13-year-old boy could not have survived even a few years. But now I think he's hopeful that he will survive into adulthood and beyond. For me, the SDG3 is exactly that, saving that life. That boy, he would not have that kind of service if it wasn't free, because he's from a poor background. It was immediately after the operation, few days, and when I looked at him, he was smiling back at me. I couldn't believe it. It was what do you call it? We have many things. We have everything. This boy has nothing, but his smile tells a lot. Maybe we're not as smiley as this little boy who has nothing. So for me, for me, Hasab al-Karim is SDG3. That's saving lives. Helping really those who need support, meaning leaving no one behind. And for that to happen, I think the call from Germany, Ghana, Norway, from Chancellor Merkel, Prime Minister Serberg, and President Addo is a great opportunity. They're saying, let's work together. And the Secretary General also gave its support. Just to leave no one behind. We have all the means. Imagine losing this boy when we have the means at hand. And that's what it means, to be honest. And coming back to your question, when this letter came, for me it was an opportunity, great opportunity. This is good opportunity. We need to work together. Of course, in the letter says WHO coordinates. We're all equals, all 11 agents that are signatory. We're equals, but one can coordinate. That's how we see even WHO's role. But real commitment to working together. I remember Tony Lake, our friend, he used to say, flags and egos, leave them out of the door and come without them and discuss. And I asked him, whose coat is this? And he said, oh, it's not mine, it's my wife's coat. Patent protected, of course. And that's it. And even when that letter came, and when I remember about my friends, be it Henrietta, Seth is here, Peter Sanders is there, many of them are in front of me, and others, I had faith. And that's why also that, the first phase of the preparation of this action plan was concluded successfully. So that was what I felt. One is an opportunity, but I also feel that we have many partners who are willing to work together. Then the other things I saw, although it's an opportunity, I saw also some challenges, because this is asking for global coordination. Then one question that came to my mind was, even in WHO itself, do we work in unity? Do we work together? No. We work in silos. We work in fragments. So one thing that came to my mind was, we have to shape up. Unless there is a seamless organization internally, it's going to be very difficult to bring coordination among partners. It should start from inside. That was one issue that came to my mind. And then the other is, okay, the global coordination is good, but from the start we have to think about the country level coordination. There should be unity at the country level. We're advocating for health in all policies, whole government. Then there should be unity among partners too. And we need to have a consensus to support countries based on their priorities, avoid duplications, and help them as one united force. That's another concern, actually, that came to my mind with the opportunity. Then, as what I said about Tony, mechanisms can be done. You can design processes, and you can draw mechanisms. You can design on how we can interact and so on. Or we can identify the strategies, align, accelerate, account. But what, in that letter, what is even more difficult, and the request is the request is a call for mindset change. Unless, as what Tony said, we have a clear, what do you call it, position, and our mindset is better, I don't think we will succeed. So these were the things that came to my mind, and although by and large I saw it as opportunity, but also I was trying to see the challenges too. And then a lot of energy also, because knowing my colleagues from all partner organizations, I could feel the energy, the cooperation. And then, of course, from internal, I would like to thank Bernard and Maria Angela, who have worked on this, and with all the teams from all partner organizations. Thank you.
Thank you. Thank you very much, Dr. Tedros, for your frankness, but also for showing your emotions, because I think sometimes in global health we talk about all these abstract things and governance and health diplomacy and whatever, at least I do. And then sometimes, we consistently need to be reminded this is about people, this can be about each and every individual life, and how what we do and how what we work on really touches people and changes their lives and even enables them to survive. And therefore, this push for a mindset change, as you indicated, is something that is absolutely essential, because we need to develop, and also when I had the honor to sit in some of the Sherpa meetings, this sense of urgency that we need to change to be able to achieve the SDGs is absolutely critical. I do want to take this opportunity also to say a very special welcome to the organizations who are part of the historic commitment that are represented here. Many of them are sitting here. I won't ask you to stand up, but it is very good to feel that, you are part of this and you feel part of this, and that is why you are here as well. It's now my great... Thank you. And many of them have participated very actively in this summit as well. We will ask Dr. Tedros to give us some commentary after the other ministers have spoken, particularly his focus on, we need to do a lot at the global level, but without what happens at country level, we will not really reach what we are hoping to achieve. It's now my great pleasure to ask the Minister Vidal from France, the Minister of Higher Education, Research and Innovation, which also indicates our link to the grand challenges and the intersectoral component. We won't reach a lot of these new goals without innovation, and we won't also reach it without the strong political commitment that also comes from your country. Please, Professor Vidal.
Mrs. and Mr. Ministers, dear colleagues, Mrs. and Mr. Ambassadors, our dear Director General Dr. Tedros, ladies and gentlemen. On behalf of President Emmanuel Macron, I wish to warmly thank the organizer of this 2018 World Health Summit and to deliver a message of optimism and hope to all participants. I wish also to reaffirm France's deep commitment to contribute to global health issues and to reach the target of SDG3, ensure healthy lives and promote well-being for all at all ages. Since the 60s, humanity has fought major diseases and has achieved many successes. We owe these victories to a number of factors: multilateral international cooperation, research and innovation, development of new drugs and delivery devices, innovative healthcare organization, all have played a major role. Sharing knowledge between researchers, policymakers, and community leaders has also been a major importance, and this is one of the benefits of a summit like the World Health Summit. Yet, despite important progress, major challenges remain for populations' health and international health security. This calls for more as well as better coordinated actions. The launch of the Global Fund Against AIDS, Tuberculosis and Malaria in 2002 was a cornerstone of the commitment of the international community in the fight against those diseases. France has played a pioneering role in this fight, and as announced by President Macron, France will host the next Global Fund Replenishment Conference in October 2019. France will also pursue its long-term support to key multilateral partnerships, Gavi and UNITAID, as well as the World Health Organization, as well as an active involvement in health projects through the Agence Française de Développement. France believes in the efficiency of a multilateral and sustainable response to global health issues, like strengthening health systems to achieve universal health coverage. This will include access to essential quality medicines and vaccines, response to health emergencies, antimicrobial resistance, AMR, or the digital healthcare revolution, among others. Considering AMR, for example, humankind is not done with the threat of infectious diseases, and the rapid development of AMR is a main issue that requires significant efforts from a diversity of stakeholders. France is dedicated to the promotion of the One Health approach and takes an active part in a number of European and international cooperations in this field. With the support of France, Europe has taken major initiatives in the field through the European Joint Programme for AMR, promoting basic and clinical research and bringing together 85 partners from 33 countries for another amount of nearly 100 million euros. France also supports the recent initiative by Germany and all the partners of the Global AMR R&D Hub, aiming at the coordination of push and pull incentives in order to make new drugs, devices, and organizations rapidly available. The global health challenges are indeed highly demanding. To be efficiently tackled, they require a combination of education, research, innovation, policymaking, and international cooperation. Thus, they need to be addressed in an increasingly coordinated and integrated way. We do thank German Chancellor Merkel, Norwegian Prime Minister Solberg, and Ghanaian President Akufo-Addo for taking the initiative with the support of the United Nations Secretary General Antonio Guterres to call for an action plan to accelerate progress towards SDG3. But to conclude, I would like to stress that SDG3, which we especially address today, cannot be considered in isolation from other SDGs, such as guaranteeing access to quality education, empowering women and girls, and fighting climate change. Next year, the French presidency of the G7 will be centered on protecting our planet and reducing inequalities, and will thus contribute to the health in all policies approach required to attain SDG 3. I was particularly happy to hear Director General Dr. Tedros outline the philosophy of a proposed action plan. Please be assured that France will be committed to help in its implementation and reach the goals it put forward. Thank you for your attention.
Thank you, Madam Minister, and thank you also for highlighting the links between health and the environment and the many other challenges that emerge from that and the planetary health notion that is frequently highlighted. I would also be amiss if I did not mention, you know it from the posters out there, that President Macron is also one of the patrons of the World Health Summit, and that is why we're particularly happy that you were able to join us here. I would now like to give the floor to State Secretary Norbert Barthle, who, as I said, represents the German Ministry of Economic Cooperation and Development, an incredibly important partner in the global health deliberations in Germany. There is a range of ministries who contribute to that, also the Ministry of Research, which is supporting the global challenges. So we're very delighted that you are here, and the floor is yours.
Thank you very much for your kind introduction. And first of all, let me say thank you very much for inviting me to join this really important event for all development policy makers. And let me congratulate to your 10 years anniversary. For me in the BMZ, in the Germany's Ministry for Economic Cooperation and Development, and for all my colleagues, I think for us the 2030 Agenda for Sustainable Development is the core guideline for everything we are doing. And if we look backwards 3 years to the year 2015 and examine what progress we had done in these 3 years, we have to say that we are not on course. We altogether need to ramp up our efforts to reach the Sustainable Development Goals by 2030. And I think the next few years will be decisive. That is why my ministry, the BMZ, has developed a scenario for the current legislative term, a scenario to improving sustainable development. And we are going on in 4 directions. Actions must be sustainable, leave no one behind, innovations for sustainability, and assisting with and insisting on sustainable financing. And our actions in this direction are guided by the following principles: ownership by the partner, expansion of the domestic base for financial revenues, and a rights-based approach which gives priority to the most vulnerable. These are some of the core values we support. And our intention is also to stop thinking only in sectors. We have to leave the thinking in silos. Therefore, I think it's very important that we have the interaction between the state, the civil society, the private sector, and the development partners. And in fact, these goals are precepts reflect in the expectations expressed by a number of civil society organizations we met last week. And during our meeting with these civil society organizations, we discussed what we expect of an action plan to speed up the implementation of the Sustainable Development Goals on health. And in the course of these discussions, we came up with a very nice graphic presentation, a bit like a mind map. And Dr. Tedros, I would like to give you this copy after our session. And I have one exemplar to show to all of you. I think it's a real nice result of this meeting. I've just come from the IMF and the World Bank's meeting on Bali. And I can say it's a very interesting but also exhausting journey. At the meeting, Jim Yong Kim, the president of the World Bank Group, said, "The smartest investments that countries can make are investments in good health services and education." And he focused all his speech on his human capital indices and his human capital prospect. And all this is reflected on the Global Health Action Plan and in the points that Dr. Tedros mentioned. I can only congratulate you on this and on the fact that you are putting the action plan in the context of the reform of the UN development system. Also an important point at the meeting of the World Bank Group. On this particular issue, we should all re-examine our briefs and traditional stances. We need to reflect critically on our work. And this exactly is what my ministry is currently doing with regard to its work. We are working on our plan BMZ 2030. Thank you.
Thank you very much. You will all have noticed the excellent gender balance in this panel. You will also have noticed that there is a certain color balance in this panel, where sort of red and pink dominates, and State Secretary Barthle has even, taken up the colors of the ladies here on this panel. I thought that was fantastic when I saw his tie. So thank you very much for that as well. But beyond that, thank you very much for taking up the really, really serious issue of UN reform. We must not forget that in the context of this action plan, and also, of course, the fascinating developments in the World Bank Group with a much stronger focus on health, but also this interface of putting people in the center as well, with the focus on human capital and health and education. And that, I hope, will really help lead us forward also since the World Bank Group is one of the partners in the action plan. I would now like to turn to Dr. Aceng, the Health Minister of Uganda, and to ask her, when you have heard all this and you look at your country level, what difference is such a historic commitment of the global health actors going to make? How do you think this kind of commitment can help with a more integrated implementation of the SDGs in your country, and perhaps also looking beyond just Uganda, looking into the region of Africa? How do you hope it will help accelerate, and in what areas? Please, Minister.
Thank you very much.
It's on.
First of all, allow me to thank the World Health Organization and in particular Dr. Tedros and the global health actors for this commitment to reinforce health as a political priority and support countries to accelerate their actions towards achieving the SDGs. This action plan, as you're all aware, is coming in 3 years after the launch of the SDG agenda. It is timely because if we take the 3 years as time that was given to countries to think through what direction and strategic interventions they could have undertaken to achieve the SDGs, it is now time for us to look at the medium-term and long-term targets that we set in place and align it to the Global Action Plan. There has been progress, and I am sure that with the action plan, there will be more progress. However, in order to accelerate the pace, there is need for work to be done. Whereas the plan has 3 strategic approaches of align, accelerate, and account, the align part is very important for the African countries. First, the global health actors have to align themselves and do it very well. I have seen in the action plan alignment in financial programming, the operational methods and other methodologies. If the global health actors can come together and do this alignment well at their level, and then have the countries supported to also align the actors within the country, much progress will be made. There is need to benchmark interventions and innovations in different countries for us to learn how they work and also inspire leadership in our various countries to take up this very seriously as a way of achieving the SDGs. A few years ago, there was no action plan for the MDGs, but many countries did well in trying to achieve the MDGs. We have unfinished agenda, but there is great opportunity to input the unfinished agenda into this great action plan where global health actors come together to support our countries. I believe by 2030 there will be great achievements. Thank you.
Thank you. Thank you, Madam Minister, and let me take this opportunity also to inform the audience here that the Council of the Assembly of the M8 Alliance decided that the regional meeting, you know, the World Health Summit regularly has regional meetings, that the regional meeting 2020 will take place in Uganda, will be hosted by Makerere University, and we hope that we see many of the organizations active in the action plan, and many of you here join us at this regional meeting to move the agenda forward. And it seems to me that it can and will be one of the functions of the World Health Summit to regularly accompany the action plan and see how it is moving forward and what the people who come together here can contribute to it. I would like to move on now to the region of the Americas and invite Dr. Verónica Espinosa from Ecuador to the Minister of Health to give us her perspective on this interface of the global and the national and perhaps the regional. I think it's on. You just speak.
Thank you. Good afternoon, Dr. Tedros, distinguished panelists, and ladies and gentlemen, of course. I wanted to start by thanking all the organizations behind the summit for inviting us and for allowing me at this moment the opportunity to present a little bit the perspective of the region of the Americas and also the national level in the accomplishment of SDGs. So as the representative of a government, of a Ministry of Health, I am very aware at the national levels and institutions and governments, we have a major responsibility with the accomplishment of these goals. And we also need to take into consideration that we will be judged by our actions and our omissions. And in the end, we will be held accountable for what we did and what we didn't do. And I really think it's important in that matter that we need to include SDG in our everyday agenda. This can be something that we consider only when high-level meetings are approaching or when we are asked to report on the progress of SDGs. We need to put this in the everyday agenda. And in order for that to happen, I think it's important to translate SDGs in our regional plans, in our national plans. And if we don't do that, having SDGs in mind just for the high-level meetings won't be enough. So I just wanted to talk a little bit about an experience that we have at the regional level, which is the health agenda for the Americas that we developed in PAHO. It was the product of a 18 countries country group. And what we tried to do is say how the health sector can contribute in the Americas to the accomplishment of SDGs. And it took us almost a year. It was a really strong effort. But in the end, I think it's a very good example of how at the regional level we can take action, the health sector can take action to actually align SDGs with regional plans and then help with that to include SDGs in the national level. And many of the countries after that have managed to include in their national development plans the SDGs. And I think this global action plan actually can contribute a lot to doing that for other regions and other countries. And just to comment on the global action plan, I'd just like to commend the efforts that have been done by WHO and also the initiative that the countries that asked for this plan took, because I just want to comment on two aspects of this global action plan that I think are going to make a difference. And the first one is that you have managed to actually keep it simple. And it's sufficient, is well designed, but simple. I don't know how many times I've heard at the national level to have politicians taking away health from the agenda because it's too complicated. We have too many complicated documents. So keeping complicated things in political agenda is really hard, and we will never make it if we continue to do so. So having a simple but complete document, a simple plan, is going to be really helpful to keep SDGs and health perspective of SDGs in the national agenda, in the international agenda, in the foreign affairs agenda, which is really hard for the health sector. Align, accelerate, account, 3 concepts, simple concepts that have a lot behind. And the second thing that I wanted to mention is how important the word together is in the document. I read it many times, and in the end, what was left in my mind was the word together. It's all the way in the document, and I think that's the spirit behind the document, and the plan is working together, is keeping together, is acting together, and is staying together. And I think if there is a silver bullet, probably is the commitment of everyone involved, civil society, citizens, organizations, countries, regional level, global level. And I just wanted to remember that staying together is not only a good way, and probably the only way, but it's also part of the commitment that we made when we approved the SDGs. And to remember also that SDGs are not a commitment from the countries with the UN or with organizations or with big panels. It's a commitment to people, to our children, to our elder, to our mothers, to the society, to the future, to the planet. And we need to keep this in mind if we want to keep SDG in the global agenda, in the national agenda. And I once again like to congratulate you for this global action plan. I think it's going to make a difference. Thank you.
Thank you very much. Thank you also for drawing attention to the plan from your region, and of course those of us in global health know how many innovations have also come from the regions of the Americas, and particularly examples of universal health coverage and universal access that are absolutely critical. Thanks also for drawing attention to the young generation, and some of you with very good ears will have heard that there are some very young generations in here. And we are talking about their future, and I hope when they grow up they might remember in their subconscious that they were at this very critical meeting that launched a global move to secure their future. So you said, Minister, we will be judged by our actions. And of course, it's one thing to sort of ask a group of organizations to develop something. The other thing is to accompany them as they develop something. So I would like to ask Dr. Stier, Germany sent that letter together with 2 others. So what now? Have they done their work?
Good question, yeah. Well, first of all, I'd like to say, because I think it's to say thank you at this occasion. When I first opened the booklet, and I think of you, it was the same, seeing this page with all the signatures was a very, very impressive sign. And of course, it is a strong signal, but it's an obligation at the same time. And we should not forget coordinating all these institutions is a challenge that could not be underestimated. Of course, we know that in our own organizations, coordination can be a problem sometime, and this applies furthermore for so many partners. So we should not forget that all these organizations are in competition when it comes to funding. So it needs a strong alignment, and it needs somebody who's coordinating that. That's why we support WHO. And I just want to say that I think that this is this action plan shows a high strategic and methodological ambition. It's very refined, and it was not just asking all the organizations for contributions and then put it into a booklet and that's it. So there's really a lot of has been a lot of work done. So I think the way is paved, and now that's right. How do we get things on the ground to really, as you said, ensure the well-being of people? Germany has always been a strong supporter for WHO, and we were able to step up our financial support for WHO's core function in the past through a few years, of course, on the decision of German Parliament. As my minister, whom I should cannot be here, and he's very sorry about that, but he had to reschedule his timetable. And he said that on Sunday, so we are able to contribute with additional 115 million euros voluntary funding for the next 4 years. And this is for the core function of WHO capacity and task, but of course it's also for the SDG3 action plan. We are a member of the executive board. We will try to use this voice as others will, so Finland, I'm sure, will. We will align with them. And I think it's important for us to get everyone on board, and we will advocate for the plan. We did that within the G20. We will do that together with France within the G7 and within the EU. So we should use any platform to advocate for this process.
Thank you. The same question goes to you, State Secretary Barthle, because you play a very important role, particularly with bilateral programs, your support to some of the partners of this plan. Would you also say how you see this support continuing?
I think for the next phases of this Global Health Action Plan, it's very important to get actors on board who are not directly concerned with health matters. For example, the action plan already explicitly mentions the World Food Programme. It is my view that we also need to get on board the IMF with regard to finance-related matters, the United Nations Environment Programme regarding clean air, or, for example, the ILO regarding decent conditions in the workplace, for example. So once the Global Health Action Plan has been presented here, at the World Health Summit, and then 10 days in Atlanta, we must seek to get wide political support among all the member states of the World Health Organizations, in particular the developing countries and the emerging economies. And we, as the BMZ, we are willing to support the consultation process with funding too, in member countries if needed. So in addition, we also take an active role on the donor side of the discussions, and I want to underline, and the action plan makes this point too, that we need to work more efficiently in a less fragmented way, so that we can make better use of synergies and avoid duplication. It's great that the World Health Organization and the Global Fund to fight AIDS, tuberculosis and malaria have just concluded a global strategy and a framework agreement on ways to work together more closely. And I think we need to work together more closely because we need good educated personnel on the health sector in the oncoming future. And if we will reach Agenda 2030, we need round about 1.3 million experts in addition. So we have to do our hard work. And that said, I want to underline that what really counts is what happens at country level. Our ideas need to come from there, and our actions need to be centered there, on the country level, and not in our offices in Geneva or in Washington or in Berlin. Thank you.
Thank you very much. So maybe if I could ask each of the ministers to say what you think will be the most important thing at country level. Just a short statement, because we'll have to move over to the other meeting, and then we will shortly have a comment from Dr. Tedros. Minister Aceng, what will be the most important thing at country level?
Well, thank you very much. First of all, we acknowledge that as a country, we cannot achieve what is stated in the action plan in isolation. We must establish strong collaboration and networking mechanisms at all fronts, both north to south, south to south, and within countries through existing and new partners and multilateral collaboration arrangements. We also need to bring on board all political leaders to understand the action plan and what is in the action plan, particularly the strategic approaches to achieving what is in the action plan. We'll need the global health actors to contribute to integrated implementation of the SDGs through ensuring that even at the global level, the different global partnership frameworks are closely linked through their mandates, and they collaborate and synergize with each other to achieve greater development aid impact. At country level, there will also be need to strengthen the framework for partnership, dialogue between governments and development partners. And the aim will be to increase the effectiveness of development assistance in support of national goals and systems of government, and ensure transparency and accountability between government and development partners and to the citizens in the management of development cooperation. There is therefore need to align country strategic plans to the plans of the global health actors, and to have a proper coordinating mechanism within the different countries that can bring all partners and global actors together. First of all, to align to one framework, and also to account to each other and to the wider stakeholders as a whole of government effort and whole of government thinking in respect of the SDGs. Thank you.
Thank you very much, Minister. I think you have highlighted some of the really important things of country coordination. We are incredibly pressed for time because we have been told that I've actually had a quarter of an hour cut from our session because we need to move into the other venue. So I must apologize to some of the other speakers. I would just like to give a short opportunity to Dr. Tedros to speak on what he has heard and what is the message that he would like to leave to the panel who are key actors in global health and to the people here in this room.
Yeah. No, thank you. Thank you very much. I mean, I will take all the inputs, and thank you so much for the inputs. One thing that's very clear is after we have endorsed SDG 2015, our start was really so slow. So, as you have rightly said, sense of urgency is important, and we need to speed up. So that's one. And second, support from member states is very important. So there should be ownership, actually. It's not even support. Ownership brings commitment. And if there is commitment, there is result. So that's really clear, and indeed it's correct. So we have to make sure that there is ownership at the country level. And then all partners, whatever we do, should recognize that fact. It's the real ownership from countries that can make a difference. And all partners should really shape up based on that. And the opportunity in here is what you have already said, the UN reform itself, which calls for country-focused and country operations based on country priorities. And let's take the UN reform as opportunity. And that's, again, very important. Then, finally, I mean, these are some of the issues I would like to raise, but you have already raised more than that. I would like to thank all partners and what they call thank you, saying thank you with this song of the heart. So we need to pause and say thank you, and I would like to thank all partners, Gavi, Global Financing Facility, the Global Fund, UNAIDS, UNDP, UNFPA, UNICEF, UNITAID, UN Women, the World Bank, and of course WHO. WFP is coming, by the way, they're working on it. So we hope they will join, and others also who will come in the future. So thank you so much again, and I would appreciate it if you give our partners a round of applause. Maybe I have to ask. Thank you. Thank you.
Thank you, Dr. Tedros. And in closing, I'd just like to draw attention to this other incredibly historical thing that is going to happen. Shortly, we will all be together in Astana to celebrate Alma Ata 40 and the commitment to primary health care. And over the next year, we'll be working on universal health coverage towards the high-level meeting at the United Nations. And as you will see from the action plan, the final reiteration of the action plan will be launched formally at this high-level meeting at the United Nations, where it should be as a cooperative effort. Thank you very much, and thank you to the panel.